আসসালামু আলাইকুম, স্বাগত জানাচ্ছি আমাদের রেগুলার আলোচনার অনুষ্ঠান ভয়েসেস অফ ডেভেলপমেন্টে। আপনারা সকলেই জানেন আমরা প্রত্যেকটি পর্বে একজন ডেভেলপমেন্ট এক্সপার্ট যাকে আমরা আহ্বান জানাই, উনি আমাদের অনুষ্ঠানে অংশগ্রহণ করেন এবং জানান যে বর্তমানে আমাদের ডোনারের যে পরিস্থিতি, এই পরিস্থিতিতে আমরা কিভাবে নিজেদেরকে একটা সাস্টেইনেবল বাংলাদেশ হিসেবে প্রতিষ্ঠিত করতে পারি। আজকে আমাদের স্টুডিওতে আমাদের সাথে উপস্থিত আছেন মিস্টার জুলিয়ান ফ্রান্সিস, যিনি অনেক দিন থেকেই এই ডেভেলপমেন্ট সেক্টরে বাংলাদেশে কাজ করছেন। উনি ইউরোপিয়ান ইউনিয়নের সাথে কাজ করেছেন, উনি অক্সফামের সাথে কাজ করেছেন, ডিএফআইডির সাথে কাজ করেছেন, CUSO এরকম কানাডিয়ান একটা প্রতিষ্ঠানের সাথেও কাজ করেছেন। দীর্ঘদিন ধরে বাংলাদেশের ডেভেলপমেন্টে উনি জড়িত এবং উনি বাংলাদেশের উন্নয়নের প্রত্যেকটা ধাপের সাথে নিজেই জড়িত ছিলেন। সেক্ষেত্রে একজন উন্নয়ন বিশেষজ্ঞ হিসেবে ওনাকে আমরা আমন্ত্রণ জানিয়েছি। চলুন আজকে তার কাছে আমরা শুনবো আমরা কিভাবে এই পরিস্থিতিতে একটা সাস্টেইনেবল বাংলাদেশের পর্যায়ে যেতে পারি। উই ওয়েলকাম ইউ Mr. Julian Francis in this program.
Thank you very much. I'm very happy to be here.
So, as we know that what is the topic we are talking about, that is the present condition of Bangladesh, that some of the donors have cut their funds, some of the donors are shrinking their funds, but as a Bangladesh, as a Bangladeshi people, we have to sustain, we have to bring out some ways that how can we sustain. So how do you define the present situation?
Well, actually when you look into the whole the many years of development, not just in Bangladesh, but it was always the hope that once a donor had helped a local organization get going, they could continue without continuous support. They could find ways of becoming self-supporting. And some of the organizations, of course not just in Bangladesh but many countries around the world, they have kept their administration going with the microcredit programs,
right.
Raising with the interest being charged, that part of that would be covering the administrative costs of the organization. But that's not the only solution or ultimate solution.
Of course.
And other organizations have experimented with income generating projects like selling handicrafts locally as well as exporting, but not all organizations can do that.
Doing it, yes.
There is I think a lot of work could have been done and should be done. It's been increasing, but not nearly enough, with the corporate social responsibility of big companies. And also there are often very rich families or rich individuals who could be approached to see if they could believe in helping set up a foundation. But that requires a lot of persuasion. There aren't so many people like Bill Gates who have an enormous amount of money and they are ready to spend it in the right way. But we know that the number of millionaires and billionaires has increased in Bangladesh. And a lot of that money has been deposited abroad.
Yep.
Even during the COVID years, the biggest deposit country during those years in Switzerland were people from Bangladesh. Bangladesh deposited more money in Switzerland than any other country. So that's a big problem which is facing the current interim government, trying to recover stolen assets. But it also it's more important to be able to set up situations where that cannot happen so
anymore,
easily. I mean, I've been interviewed many times, even within the last 12 months, and I'm saying, well, one of the biggest problems in this country is that the people who should be paying income tax are not paying income tax. They are managing to avoid it. So it's very unfortunate that this can happen, and it's also very difficult to know how to put that right quickly.
Yes, what you said, it's I must say that this is not expected at all, but this has happened, but we have to survive and we have to plan for the future. So if we see the numbers or the data directly or indirectly, around 30 million people got affected on this fund cuts. So what's your idea as you go to the field, you talk to people, you talk about projects? So what are your findings? How people are coping up with this situation now? How they are planning to cope up, or how they are planning differently without fund?
Well, the different organizations are thinking quite seriously about how to do their work more efficiently, and in some cases they will and are planning to work closely with other organizations, so they will jointly do things which will save administrative costs and so on. It may mean some people might lose their jobs, but it might be a more efficient way of working all together.
Yeah.
If you're in the same district or something like that. And I think the well-established organizations such as NDP are very open to the possibility of
partnerships and collaborations. Yeah.
So I think that is a way forward, but the other thing is, which some people think that I beat the same drum all the time, is that there should be more communication with the people you want to help. If they have ideas about how to be able to sustain themselves in a better way.
Okay.
And often that produces quite interesting things. It may be, you know, traditional handicrafts that could be they were making them. They have that expertise, but they haven't been making them, and whether they can make them again and find a market. All these things need exploring, and then the other thing is that, particularly in the rural areas, a lot of the development agencies come in and want to do modern agriculture, scientific farming, hybrid seed, fertilizer, and so on. Well, that can be costly, but do the local people know what they can do with local varieties of seeds and so on, which will not produce the finished quantity as much as modern agriculture, but these are things that need to be explored all
more.
the time, because the fact that the beneficiaries may not have been to school doesn't mean they don't know anything.
Yeah.
They are the local experts. So
Exactly.
it is always important not only to listen but to ask questions and listen.
To the beneficiaries who were, or to the community people.
If they have
how
any
can we
ideas.
make plans
Yeah.
in a participatory approach.
Well, the other thing is, of course, to develop good relationships with the local government,
Yeah.
which in many cases happens anyway, but maybe more can be done.
Yeah, because you know, in a type of crisis, people become more friendly with each other, not only with humans as well as with the living being around them. So this is a crisis moment. We should ask for more communication and more cooperation.
And now you've got much more, many ways of communicating with the mobile phone network.
Yeah.
And
Social media.
Yeah, social media, and a lot of schemes like giving advice to farmers or health advice are already for many years on the mobile phone network.
And those will just minimize the costs as well. So in low cost approach, we can also think that how can we reach to more people with more low cost. It was maybe 7-star standard. It could be now 3-star standard, but we can go on with that, no?
Yes, indeed.
Yeah, that's the sustainability plan. What you said, it's really relatable, and I must say that it should be applicable, and it is applicable in our community. Now, would you please say that what could be the role of government in this kind of initiatives, that when we are thinking of enterprise development or thinking of partnership-based activities, what should be the role of government here with the development agencies?
Well, the government needs to, rather than top-down talking to people and organizations, they need to see what the scope is for collaboration and
bottom up.
Yeah, and also you see you will find in many villages where a rich man has donated money to set up a mosque or a school in the memory of one of his family members, or suppose his wife had passed away, and
father, mother, in that.
Yeah, like that. And so if somehow the consultation can be with those sort of people to develop something for the village, for the community. And it's not easy. It needs to be done very tactfully and softly, if you like. But where we know that there are people who are generous, but they're not sure how their money will be used. You know,
and they don't know actually, and they cannot see the proper use of their money.
That's right.
Yeah.
So I mean, and if there were good examples in the past where they set up the community clinics.
Yep.
Now, when there were the local people, local elite, if you like, took interest, it worked very well.
Surely.
They made sure that people were using it, and also if there were a shortage of supplies, basic supplies, they would make the government department responsible. They would inform them to make sure that it is running well. So in some places it wasn't running well at all, but where the local community were working well together, it worked, and that wasn't necessarily because there was an influential NGO that made the community clinic work, but it was just the whole community organization. And it's very difficult to come in with a blueprint of, well, this is how you should do things on a village level, because it will vary according to where you are.
Yeah, like just one example came to my mind related to this. Like in Islam, it is said that the best sadaqah you can give is giving water to people, to thirsty people. So, and the people who are building mosques in the village, they do it for sadaqah and all these things, that okay, it will go after my death and I will get the reward. So if we can approach in that way, that if you develop a community water filter, you are giving water to the people.
Yeah.
What NGOs are doing, then those people can invest over there as a sadaqah or as a rewarding work. So yes, we should change the approach we used to do. We should change the approach to the people who can invest money, who can donate money. Yes,
right.
You are very much right. So in that case, if we just plan for the future, if we make a future plan, and I request you to tell 5 points accordingly, that what could be the future plan to make a sustainable, developed community in Bangladesh. So what would be the first 5 points according to you?
Well, I mean, there are points from the top to the bottom and from the bottom up, you know. It's important that, you know, at the village level there is consultation between both the rich families as well as the poor families.
Right.
And that is not easy to organize.
Yeah.
And then, well, from the top, not only needs to be a much more serious effort to raise money from income tax, but in the middle level, at the district or upazila union level, there has to be more interaction, more discussion, sharing of successes and sharing of failures as well, you know, because you can learn a lot from failures, that was one of the important findings or assessments of BRAC, was that from the very beginning that the BRAC documented their successes as well as their failures.
Yes.
So, and then the documentation of failures helped other people not to make the same mistakes.
Right.
That's very unusual. And also, at the same time, what we're saying about poor people who have not been to school can be the local experts. It's also important to tell donors that some of their policies might not be correct.
Yeah.
In the past, donors have said, who have been funding a particular NGO for a number of years, they said, I'm talking about a long time ago, but as an example, they said to two organizations, you should not be dependent on foreign funds forever.
Ever.
So, for one of the organizations, they gave a grant to set up a bus company.
Okay.
To another one, a garment factory. But neither of these organizations had any commercial experience of running a business like that.
Yeah.
The bus company collapsed very quickly, and the garments factory was only saved by BRAC.
Okay, so BRAC took it over.
So took that over, but the bus company was set up to be a VIP bus company. You would get a bottle of water, you would get a clean thing on your back, your headrest, and only the number of people in the bus according to the number of seats. You couldn't have any extra people. So it couldn't make money. And it was a disaster. And the donor, which was Canadian Cedar, never admitted they were wrong.
Oh, okay.
It was hidden.
Yeah. So yes, we have to think aligned with the situation, aligned with the community, as well as we have to think that, how we can reach to our community more and take feedback from them and plan accordingly that what is actually their need and what is development in their views, and then we can plan accordingly that yes, if we want to develop our community, we have to do this things accordingly, right? This is your suggestions.
Yeah, and I in the whole area, for instance, of community health, there are a lot of local practical ideas, practical experiences, practical knowledge that can help the health of the community. So, you know, when I first came to India more than 50 years ago, the local people had all the medicinal plants that they used for, if you have a fever, you this, a stomach problem, have this, and so on. Now, that is limited now, although, I mean, my helper for the last 22 years is a Garo woman, and before that, her mother was working with me. And if I had a stomach problem, I would get better with grandmother's
recipe,
potion, you know, whatever was put together, you know. So it's these things, traditional knowledge, unfortunately has been discarded in many places. But if there is a way of revitalizing that, and people, for instance, many people don't believe in homeopathy. And there are medicinal plants here that can help health. I have a very good friend who in Kolkata who has a degree, an MBBS degree, as well as a homeopathic degree. So all the patients are tested as though, you know, it is the modern way, X-rays and blood tests and so on. But then he knows that these people cannot afford the allopathic medicine. And for some diseases, he knows that a particular homeopathic medicine is effective and much cheaper. So then
he suggested or prescribed that balance.
So there are different ways of, you know, handling,
making it possible.
Different ways of dealing with healthcare. So but it's a challenge, and people are not always ready to. I don't believe that will work, and that sort of thing.
right. So yeah, making that awareness also is necessary. Actually, we cannot blame anybody here, because to make this kind of mentality, we had a lot of workshops, we had a lot of awareness programs that do not go for the homeopathy, do not go with the plants, and do not go with this natural remedies. Please go to doctor for allopathic treatment and all that. There were a lot of awareness to develop this kind of mentality as well. So now we are in a situation, the people who believe on those kind of medicine, they are also suffering that they cannot get all this kind of medicine available, and who are having this allopathy treatment, they are also suffering that they are so costly that they cannot afford it. So of course we have to make a balance of it. Before that, we have to make people aware to generate the demand of this kind of medicine, of course. Yeah, a very effective and very fruitful discussion, I must say, and thank you so much for your valuable time. Hopefully we will get you again for some different type of discussion. You are a very good advisor, I must say, and you have a lot of experience to share with us, as you have seen Bangladesh from here, from the very beginning. So you are a very good resource. Thank you so much for being with us and for your valuable time.
Thank you, it's been a pleasure.
So আমাদের সাথে থাকুন এবং এরকম কিছু ইনফরমেশন জানতে, আপনাদের মতামত জানাতে আপনারা দেখতে থাকুন ভয়েসেস অফ ডেভেলপমেন্ট। থ্যাংক ইউ সো মাচ।